Hello. When it comes to neurosurgery, one aspect that all neurosurgeons are really paranoid about is the side of the lesion or the side where the problem is. Since we make relatively small openings very close to the site of the tumor, the side becomes extremely important. It's not that this is a hollow object over there that you open somewhere and you can deal with the problem on the other side. No. When it comes to neurosurgery, we have to open it at the precise spot on the precise side. And yes, we do confirm that time and again preoperatively just before the surgery. So we take time outs and we try and confirm it. We have an MRI or a CT scan image, we corroborate with that and confirm it time and again before we start our surgical procedure. And that happens because there is no external indicator about where the site of the lesion could be, which side is the problem. There is nothing externally which would tell me where the tumor is. But yes, in some cases, it gets doubly confusing, and I'll tell you why. Now imagine a patient with a head trauma. So you see a big bruise over here, swelling on one side. So that is an external indicator of the site of trauma. So we would presume that the injury is on this side and this is the part which needs to be opened. And that is a time when the entire pathophysiology of trauma throws a surprise at us. There is an entity called counter-coup injury. In this, what happens is the impact is on this side. The primary impact is on one side. And because of that impact, maybe there is a fracture, maybe there is some swelling around there, maybe there is some external wound. But what happens is the brain goes and bangs itself on the skull of the opposite side, as a result of which there could be severe injury and at times much more severe than the site of impact because of this secondary impact on the skull. And if there is a bleeder over there which starts bleeding, then the main problem could be on the opposite side. So that's a time when it gets confusing, and that entity is called counter-coup injury. So we are always careful. So in spite of having external findings which could suggest the site of injury, we still confirm and reconfirm the side of the lesion. Thank you so much.